So the next thing we're going to look at is single leg stance. And stand on your right leg. Okay? And now stand on your left leg. Good. What you're looking for, the two main compensations if the hips aren't working quite right or the abs aren't, is that they'll either lean the trunk over the stance leg or they'll drop out in that direction, right? They'll drop that unweighted hip. If that's going on, that can cause all kinds of problems. Actually, the list is too long to get into. You know, if they're dropping out when they're running or walking, you know, you get IT band syndrome. You can get all kinds of stuff going on. You can strain the back, whatever the case may be. But you definitely want to look and see how are the hips firing when they're doing that. And I also have them, after the first few, have them do like 30-second holds. Because sometimes they'll hold really well for like 5 or 10, and then by 20 or 30 they're completely unstable. So you have to wonder, okay, they look good at first, but get them on a treadmill for 10 minutes. After a few minutes, those hips are already going to be fatigued, and they're going to be putting all kinds of abnormal stresses. So check the endurance component of it too. The other thing to look at there is how stable is the ankle. Sometimes they look really good here, but they're real wobbly on the bottom, and that can obviously cause problems as well, especially in kind of running situations. So look at both of those things, and then just address in your program whatever you find. Going right into the next one with the single leg squat. So the single leg stance that we just did was looking a little bit more at frontal or coronal plane stability, kind of side to side. When you add the squat in, you're adding in the transverse plane or the rotational instability component. So I like to do the one-legged squat with the other leg out rather than back because it mimics going downstairs. It's just a little more functional. When you have them, lower down, and first of all, does it hurt? If it's just mildly uncomfortable, usually that's going to probably work itself out as you get stronger. But if they have debilitating pain or can't go very low with that, that'd be something to have them check out before you get deep into a leg program or something like that. But the main thing with this is, does the knee stay over the toes, right? If they're dropping in, it's a real big problem, because what it does is, usually in most cases, it's showing that the hip external rotators are not doing their job to stabilize the leg. And I would think that that component or that injury predisposition is present in, I haven't looked at studies on this, but I would guess more than half of your major knee injuries, if you had that person do, except for maybe a football player that gets swiped in the legs, but most of your knee injuries, if you had the person do this beforehand, they're going to be dropping in like that. Okay, and so then in those cases, there's tons of great exercises to strengthen the hip rotators. But this is where I wanted to show this one, because I don't see it a lot in gyms. I see it in clinics, but not gyms so much. Can you hold this for me, if I can get it untangled? So you get your client a good resistance for their abilities. Just go ahead and hold that. And they're going to do a 360 spin. Did I just screw up the sound? Okay. I'm going to get on one leg, and they're going to just slowly move into rotation in both directions as far as they can. It's a little more challenging than you'd actually expect. And once they've gotten those directions in and that set done, they can spin around twice, do the same leg, but now the pull is obviously coming from the other direction, right? So I like this exercise because it doesn't just challenge the rotators of the hip, but the whole leg. One thing you'd want to do is make sure, thank you, that you don't use that one on people with known hip, knee, or ankle arthritic, cartilage breakdown kind of issues, because it is kind of a weighted torsion grinding thing. There are safer ways to strengthen when that's the case. So if you do see that there's issues with the single leg squat in terms of the hip stability, the knees going in, things to watch out for, to wait on until you've got them strong and showing that stability would be lower body plyometrics, box drops, a lot of cutting, agility stuff. I'd wait on until you saw that they're really, really stable with that test. Is there anyone here with a history of ankle sprains or ankle issues by chance? Come on up, if you don't mind. Okay, so I just want you to face everybody, and with your legs apart a little bit, however you would do a squat, keeping your heels on the ground. Go ahead and just do a squat for us. Okay. Okay. Yeah. So, and come on back up. With this, what you're going to look from all sides. You're looking from the back, the side, and the front. With the front, you're again looking for, are the knees dropping in? But from the back and the front, you look, are they loading each side equally? Are they overloading one side versus the other? So go ahead and do another squat for us. Okay. And so this is pretty classic. So what she did there, and I could immediately tell it was her left ankle before she said anything, because when she drops down, she gets to a point where she can't go further with her knee because she doesn't have enough dorsiflexion in her ankle. But this knee can go further. So what happens is this, it's a rotation. So I've had a lot of patients in the past with say a right hip, right knee, right ankle, or some kind of back issue. And the thing that led to it was the fact that they sprained their ankle 2 years ago, and they've been doing squats like this, right? So they're just loading that side, right? So you want to look from the front and back. Are they loading evenly, first of all? If they're shifting, are they immediately shifting? Like it's some kind of a neuro pattern, or are they just got in the habit of staying off one side versus the other? Are they real nice and symmetrical till they get low and then they tilt off? That's usually going to be more of a hip or ankle range of motion issue. Okay, if both ankles are limited, what you'll see is they get to there, they can't go further, so to get deeper, well, she was smart and she just stopped. But like I see a lot of high school athletes in the clinic, and it amazes me that they're told to do box squats, touch the box down here, but they have no dorsiflexion. They're like stuck there. So what they do is, what happens, they can either fall backwards or they have to lean forward with this big load on their back, and then they strain their back. So kind of the consequences of ankle issues on one side is that you'll usually overload the opposite side. And then if they're both tight, you'll usually bend forward too much. And then the back's at risk. To look at each of them individually, I have them do knee drives. Put your hands here, put one foot forward. Let's do the right foot first, and this foot back. Okay? And you're just gonna drive this knee forward over your toes as far as you can. No, keep the heel down. Don't worry about this, we're just looking at the right. Okay, so as far as you can, keeping the heel down. Now what keeps you from going any further is okay, so let this heel come up, that's okay. We're looking at the right side. Okay, so go as far as you can. Tell me what stops you. Is it a pull back here, a binding in the front?
Pretty much my right gastroc and
okay.
Achilles tendon.
Good. Come on, out of that. So that's good. On her right side, she's good. What you want to feel at that end range is that, or what you want them to feel is that they have a stretch here somewhere along in the gastroc soleus or down in the Achilles, right? If they're having a binding in the front, that's a problem, and it needs to be fixed. And manual therapy, those who know how to do it can fix that really quickly. Go ahead and try that on your left now. Just drive that knee forward. Yeah, that's fine, yeah. Okay, so come back. No, keep that heel down. Okay, what keeps you from going further forward there? So she, surprising to me, doesn't have that block feeling in the front, even though she's really limited. What I would do with her is probably work on the posterior side of her leg, loosen that up, and then the next time she did it, she probably would get the block feeling, because that's more of a scar tissue thing that can build up from, especially with ankle sprains. Thank you so much, appreciate it. So again, with the squat, you're looking at it from all sides. Are they loading evenly? Is there an issue like a pinching at the hip or a block at the ankle that is causing them, or maybe a knee pain or whatever? What you have to kind of communicate with them. Why aren't you loading symmetrically? Try to get to the bottom of that. If it's something like the ankle stuff, just stretching a tight ankle. If it's a joint thing, it's probably just going to grind the ankle. It needs to be released with some stuff, some techniques. But if it's just a stretch in the back, foam rolling, stretching, things like that should knock it out, and you just kind of incorporate that into your program.